Cardiovascular diseases are the leading cause of death globally and include coronary artery disease, cardiomyopathy, heart failure, hypertensive heart disease, ischemic heart disease, strokes, and many more. According to the World Health Organization, an estimated 17 million people died from cardiovascular disease in 2008, representing 30% of all global deaths. They have also identified the main risk factors of cardiovascular diseases targeted by conventional drugs, which are blood pressure, low-density lipoprotein cholesterol, platelet function, and homocysteine levels. So how do we combat cardiovascular diseases and their risk factors? With controversy. A polypill has been suggested by Walden Law in 2003 and has been through rigorous research since. Daily treatment with the polypill, which comprises of 6 drug components, each targeting one of the previously mentioned risk factors, could lead to the prevention of 80% of cardiovascular diseases. So what is this thing made of exactly? The polypill consists of a combination of aspirin, up to 5 different types of antihypertensive drugs, folic acid, and statins. Right, so what do these do? Statins, which are a group of compounds that competitively inhibit HMG-CoA reductase enzyme in cholesterol synthesis. This means a reduction of low-density lipoprotein cholesterol concentration. Antihypertensive drugs are a form of drug that reduce high blood pressure in the body. The polypill includes the following antihypertensive drugs. Diuretics, which regulate urine production by hormonal interaction, decreasing the overall fluid volume in the body, thus lowering blood pressure. Beta blockers are antagonists of the beta-1 adrenoreceptor and induce the blockade of epinephrine and norepinephrine effects, leading to a general reduction in excitement, heart rate, force of contraction, and ultimately blood pressure. Angiotensin-converting enzyme inhibitors, ACE inhibitors, inhibit the conversion of angiotensin 1 to angiotensin 2, which is a potent vasoconstrictor and upregulator of aldosterone. Inhibition of this pathway leads to a decreased blood pressure. Angiotensin 2 receptor antagonists, which are responsible for direct inhibition of vasoconstriction, vasopressin secretion, and aldosterone production. The inhibition of these leads to lower vessel resistance and blood volume. Calcium channel blockers. Blockage of calcium will prevent excitable potentials and result in slower heart conduction. Folic acid lowers homocysteine levels. Homocysteine promotes atherosclerosis by destroying epithelial lining and blood clot formations. Aspirin, which regulates platelet activity by inhibiting the overall blood clotting process. With less platelet aggregation, there is improved blood flow and reduced vessel resistance. Great! This pill seems extremely advantageous, and that's right. These advantages include improved delivery of treatment. We get less adverse effects with multiple low doses of different drugs. Improved patient compliance. People are happier to take 1 pill per day rather than 5 or more. Lower costs. It's estimated that the polypill only costs $1 per day in developed countries and less than 20 cents in developing countries. Simple prescription and ease of distribution. This is extremely advantageous in the resource-limited healthcare facilities and in developing countries. But with great advantages comes disadvantages, and these come in the form of adverse effects of the individual drugs used to make the polypill, which include a dose-response relationship for thiazides, beta blockers, and calcium channel blockers. This means the higher the dose, the more prevalent the side effects. Common symptoms include dizziness, nausea, flushing, myalgia, and a cough. Majority of the adverse effects of the polypill stem from aspirin. The polypill may not be suitable for some people. Beta blockers are unsuitable for those with asthma, while some people are intolerant of aspirin. The polypill seems very fixed. Is there no variation? Well, we're in luck. Various other researchers have been testing other polypill combinations, one of which is the polycap, and includes thiazide, atenolol, ramipril, simvastatin, and aspirin. Studies conclude that the polycap formulation will be conveniently used instead of single drugs to reduce multiple cardiovascular problems. Several clinical trials are currently being run to test the safety and efficacy of the polypill concept. Some of these trials include the International Polycap Study 3, using a combination of 3 antihypertensive medications, which are atenolol, hydrochlorothiazide, and ramipril, as well as the inclusion of aspirin. The Heart Outcomes Prevention Evaluation 3, which consists of therapy with rosuvastatin, candesartan, and hydrochlorothiazide. The prevention of cardiovascular disease in middle-aged and elderly Iranians using a single polypill polyiran, which includes aspirin, alanapril or valsartan, atorvastatin, and hydrochlorothiazide. Where does this leave us? With future challenges of the polypill. The polypill may lead to a false sense of security due to the supposed immunity brought about by the pill. This may lead patients to marginalize important lifestyle modifications such as diet and exercise. Current physicians are hostile to the concept of the polypill, which is a fixed-dose combination pill. There will need to be considerable retraining of primary care specialists and physicians before the widespread acceptance of the polypill. Also, drug recombinations may result in adverse effects. Thus, agents used in the polypill must be safe, well tolerated, effective, and physicochemically compatible with other components of the pill. There is also the potential for drug reactions with other drugs that the patient may be taking, or with some foods, and can affect the bioavailability and efficacy of the polypill. The polypill has something for everyone. Its bold concept will pave the way for future variations of medication to combat the risks of cardiovascular diseases, and will ultimately lead to a stronger, better pumping world.